Most often, genetic testing is ordered by a provider. This can be ordered or coordinated by a few different individuals, genetic counselors, other genetics providers, providers like oncologists or OBGYNs, APPs. Depending on the specific state, there may be restrictions about who is listed as the actual ordering provider. So, for example, in Michigan, I will have an ordering physician on all of my genetic testing orders, even though I would be the one typically coordinating that testing. A different kind of genetic testing that patients can have completed is called direct to consumer or patient initiated genetic testing. So patients can purchase a kit directly from a company. That kit gets mailed to their home and they can mail it back to the lab and receive their results online, often without a healthcare provider being involved. There are a lot of different tests on the market that patients can order and complete on their own. There's also different options for what this testing looks like. So it can be more recreational, giving information about things like ancestry, whereas there are some tests that actually are more clinical that are similar to what might be ordered by a genetic counselor in a cancer setting. So early versions of this testing were really typically more recreational. So looking at things like ancestry, certain traits like liking cilantro or not, in some cases talked about health risks. With these early tests, pretty much everything needed confirmation with follow-up clinical testing, which is typically still the case for most. For negative results, these may not be true negative results. So an example of this is certain labs that offer direct-to-consumer testing will state that they offer testing of the BRCA1 and 2 genes, but this may just be for a small number of sites in those genes and not comprehensive testing of the entire gene. So there's a lot that could be missed. More recently, there's sequencing that's become available to be ordered by patients directly that is very similar to what we might order in a cancer genetics clinic, and in some cases is actually completed by the same labs that we may use. Benefits of this can be accessibility. So some people don't live in a place or don't have, a healthcare team set up where they are able to meet with a genetics provider to have this testing completed. These tend to be relatively low cost. Many are between about $250 to $300. Some patients who are concerned about privacy may prefer to do a direct-to-consumer test. One caveat that I talk about with patients is just, while it's true that something that gets sent directly to your home without a healthcare provider of yours involved won't be in your medical record immediately. If there was something on that testing that follow-up was recommended for, then that is something that a patient would want in their medical record to make sure that, for example, if they were at high risk for colon cancer, there's some documentation of why we'd be recommending colonoscopies at a younger age. One thing that can be both a benefit and a limitation is that variants of uncertain significance or inconclusive findings are typically not reported on direct-to-consumer testing. This can be viewed as a benefit because it can help eliminate some confusion around these types of results. But a limitation, of course, is that if there's an update to this variant of uncertain significance in the future, the patient may not be alerted the same way they would be as if they had had clinical testing with a provider and had that variant of uncertain significance disclosed on their initial report. Other limitations in this setting include that generally these tests are kind of a one-size-fits-all. It's a set number of genes, which may be appropriate for most individuals, but depending on a person's specific personal and family history, if they do have a very rare tumor type, for example, that might not be something that's covered in more of a common cancer's multi-gene panel. Other limitations are also that if this is done outside of a healthcare setting, patients may not know where to go for follow-up care or management and may not know even like who to follow up with if they do get a positive result back from testing. Another type of result that has become available to patients more recently is that certain companies will release a person's entire raw data of their sequencing analysis What people can then do with that is put it into a software that is intended to analyze it. What we've found in our experience is that this leads to a lot of false positives. So, for example, a patient will come in with a report that actually says they have both a BRCA1 and an MLH1 Lynch syndrome related pathogenic variant based on them putting their raw sequencing data through an online software. And when we repeat this clinically, we don't actually find that those are confirmed. So that was a false positive. By the same token, we expect there's also likely false negatives when testing is done this way, just based on some inaccuracies in how the sequencing and reporting may be completed and some of the technology surrounding that. Generally, these results are not useful for clinical management. At least what's offered now, so we're always recommending patients have clinical follow-up if they do have what comes back as a positive result from this testing, or even if they have a negative result, if they have a personal or family history reason to be tested, we are going to want to confirm that through a clinical lab. I've listed some resources here for patients where they can get information online about direct-to-consumer genetic tests, as well as a genetic testing company or a genetic counseling company that has some more information about this type of testing as well.